Hello, I am Dr. Elliot Davis. This dental tutorial provides insight into a recently developed, sophisticated alternative treatment to the traditional gum grafting surgery. It is titled Periodontal Gum Recession Treatment, a non-invasive alternative to gingival grafting surgery incorporating advanced Invisalign orthodontic and teeth whitening concepts. To keep things as copacetic and comfortable as possible, please read the appropriate disclaimer prior to viewing this tutorial. This dental tutorial is intended to be informational in nature. It contains some highly graphical photography that some might deem offensive. Please accept my apology if you are bothered by a portion of the content. This young man who recently moved to New York from California came in for a teeth whitening consultation. He had other concerns. He wanted to make sure the spaces between his teeth that were closed with braces were not returning. He was getting food stuck between his teeth. His gums were tender and would bleed when he brushed or flossed his teeth. The dental exam revealed inflamed gums. There were significant amounts of calculus and stain. The maxillary post-treatment orthodontic splint was intact, but the mandibular splint was not. There were receding gums with notched and exposed roots. These are common signs of malocclusion or a bad bite. Here is a look at the puffy gums throughout his mouth. Along with the modest periodontal pocket depths, the gap between his gums, teeth, and bone, the diagnosis of gingivitis was confirmed. If we look at the notching on his top left next to the teeth, the top right, and the lower right, that confirms that there's some malocclusion present in his mouth. The view inside his mouth revealed some very heavy staining. This is looking at the tongue, from the tongue's point of view, at the lower front teeth. You'll notice some remnants of a splint that was placed on after orthodontic therapy had completed. There's 2 pieces that are still here. This likely continued when it was first placed over all 6 front teeth. For the gingivitis, I recommended non-surgical periodontal scaling and root planing. I would remove the remaining metal and composite remnants of the splints in his mouth. To help with the malocclusion and gingivitis, I would orthodontically reposition his teeth with Invisalign. He told me he had braces as a teenager and that his teeth were straight enough. I informed him that the main reason for his orthodontic therapy was to help his gums, teeth, and bone be as healthy as possible. Aesthetics was not the goal. To brighten his teeth, I recommended custom at-home teeth whitening. Of the 6 types of professional teeth whitening, this was the most appropriate choice for him. He confirmed he knew the condition of his gums concerned me, especially the lower front. He would either make an appointment now to start treatment or come back for his cleaning and checkup in 3 months. His oral condition had changed. It had not stayed the same. It had gotten worse. There was a new diagnosis. He had moderate periodontal disease. There was also a new treatment to consider, periodontal gum grafting surgery. The most serious concern, the significant bone loss on one of his lower front teeth. The gum levels of the lower 4 front teeth should line up. As you can see, the discrepancy is now 3 to 4 millimeters. This was the area that demanded urgent attention. His gums now would bleed when he eats. This was last year, this was this year. Last year, this year. If you're like me, what resonated was how could he not know something was wrong if his mouth was bleeding when he was eating? When he spoke or smiled, his lower teeth and gums were hidden. He only had pain and bleeding sporadically when he ate. It was not all the time. He did not think the bleeding and pain were atypical and a concern. Both periodontal gum grafting surgery and orthodontic repositioning treatments were discussed. His mother in California was given remote access to my computer and was an active participant in the treatment decision process. He chose the non-surgical option, the less invasive option, Invisalign orthodontic therapy. By the third month, the health of his mouth showed the signs of a swift turnaround. The new bone formed covers almost all of the root that was exposed and covered with plaque and calculus. March to June, 3 months later. The puffiness is reduced. Even some of the notching, the gum next to it, that has gotten softer. Bone has come back. The gum is much healthier, and there's much less accumulation. The new smile is starting to show signs of improvement as well. This is about the midway point through therapy. What was our area of chief focus? This was the problem. This was the solution. Absolutely magnificent results. The concept of treating acute periodontal disease with bone development via orthodontic therapy is a novel approach. It is a non-invasive, conservative, and cost-effective procedure. Could an experienced, board-certified periodontist match the excellent results achieved with the more traditional, more aggressive, and more uncomfortable and more costly gingival gum grafting surgery? It is fair to say that without the repositioning of the teeth and the new bone formation, without the improvement of the bite, the likelihood of a similar long-term excellent result, the likelihood of relapse avoidance would be diminished. Was this an example of a periodontal success? Of an orthodontic success? I think it's an example of a periodontal and orthodontic success. I am Dr. Elliot Davis, the Manhattan Dentist. Thank you for your interest and for watching.